Vertigo is a sensation of spinning or dizziness, often described as feeling like you or your surroundings are moving or spinning when there is no actual movement. It is a symptom rather than a condition and is commonly linked to problems in the inner ear, brain, or sensory nerve pathways that help maintain balance. Types of vertigo. Vertigo can be classified into two main types based on its cause. 1. Peripheral vertigo, caused by issues in the inner ear or vestibular nerve, responsible for balance. Common conditions causing peripheral vertigo. Benign paroxysmal positional vertigo, BPPV, triggered by changes in head position, caused by displaced calcium crystals in the inner ear. Meniere's disease, a chronic condition associated with fluid buildup in the inner ear, causing vertigo, hearing loss, and tinnitus. Vestibular neuritis, inflammation of the vestibular nerve, often due to a viral infection. Labyrinthitis, inflammation of the inner ear due to infection, affecting both hearing and balance. 2. Central vertigo, caused by issues in the brain, particularly in the cerebellum or brainstem, which regulate balance. Common causes include migraine-associated vertigo, linked to migraines. Stroke or transient ischemic attack, TIA, affects areas of the brain involved in balance. Multiple sclerosis, MS, can damage nerve pathways involved in balance. Brain tumors, rarely, tumors in the cerebellum or brainstem, can cause vertigo. Symptoms. Vertigo can vary in intensity and duration, but common symptoms include a spinning or whirling sensation, nausea and vomiting, loss of balance or unsteadiness, difficulty focusing the eyes or blurred vision, nystagmus, sweating, hearing changes, e.g., ringing in the ears or hearing loss, in some cases. Symptoms can last from a few seconds to hours or even days, depending on the underlying cause. Causes. Vertigo can result from various conditions or factors, including inner ear disorders, e.g., BPPV, Meniere's disease. Head injury can damage the inner ear or brain. Infections, viral or bacterial infections affecting the inner ear or vestibular nerve. Medications, certain drugs like aminoglycoside antibiotics or diuretics can cause inner ear damage. Chronic conditions, such as migraines or cardiovascular issues affecting blood flow to the brain. Diagnosis. Diagnosing vertigo involves a combination of medical history, physical exams, and specific tests. 1. Medical history, identifying symptoms, duration, and triggers. 2. Physical exam, checking for balance issues, nystagmus, involuntary eye movement, or hearing problems. 3. Dix-Hallpike maneuver, a test to diagnose BPPV by observing eye movements during head positioning. 4. Hearing tests, to evaluate any associated hearing loss. 5. Imaging tests, MRI or CT scans may be used to detect central causes like brain lesions or strokes. Treatment. Treatment depends on the cause of vertigo and may include 1. Medications. Antihistamines, e.g., meclizine, to reduce dizziness. Antiemetics, to relieve nausea and vomiting. Benzodiazepines, e.g., diazepam, for severe symptoms, though they are not a long-term solution. Diuretics, to manage fluid buildup in Meniere's disease. 2. Vestibular rehabilitation therapy, VRT, a series of exercises to improve balance by retraining the brain to compensate for inner ear issues. 3. Epley maneuver, a specific head and body positioning technique used to treat BPPV by repositioning displaced calcium crystals in the inner ear. 4. Lifestyle changes, avoiding sudden head movements, reducing salt and caffeine intake for Meniere's disease, staying hydrated and managing stress. 5. Surgical intervention. Rarely, surgery may be needed for severe or persistent cases, such as removing problematic inner ear structures or repairing abnormalities. When to seek medical attention. Seek immediate medical care if vertigo is accompanied by severe headache, difficulty speaking or walking, weakness or numbness on one side of the body, double vision, fainting or loss of consciousness. Prevention. While not all vertigo can be prevented, some steps may help reduce the risk. Avoid rapid head movements or changes in position. Manage chronic conditions like migraines or cardiovascular disease. Avoid excessive alcohol and caffeine intake. Stay physically active to maintain good balance. If you experience persistent or recurring vertigo, consult a healthcare professional for evaluation and proper management.